poke in the eye with a sharp stick and get through it okay?
I guess so in the short term. So we then go through the rest of this sensory motor pathway, looking at things like the way that the central nervous system processes signaling. We look at issues of autonomic influence. And the result of going through 8 or 9 steps of this sensory motor pathway is to identify all those errors that are causing inappropriate perception of pain or inappropriate spasticity. And by doing that, to resolve the pain, it's not analogous to using an anesthetic, because if we use an anesthetic, pain that should be there, that's appropriate to protect us, would be covered up. And there's nothing in the neuromodulation system that does that. Our goal is simply to identify and correct body function that shouldn't be there. So pain that's inappropriate to the circumstances, chronic pain in particular, is something that persists long after the healing process has been completed. Chronic pain is something that responds very quickly to NMT because it's an error. It's the body locked into a physiology that may have been appropriate at one time, shortly after an injury, but no longer is appropriate.
So once you're able to create the dialogue, you're able to pinpoint where the misinformation has occurred. How do you then begin creating the dialogue again to get the agreement for the pattern that's been holding to release itself and go back into a healing pattern or a healing status?
The agreement is signaled by the muscle test, by the galvanic skin response, by the use of the friction device that you mentioned. And the agreement takes us step by step by step through a multi-step process that constitutes the NMT clinical pathway that's being used.
So that's where the protocols are this is where it becomes very refined in terms and exact in the protocol from that point forward to go through layer after layer until you find out, aha, there it is, there's the seed.
That's right.
Okay.
So as we apply these pathways, we identify what number of pathways might be required in order to resolve the problem that the patient presents with.
So how quickly can NMT begin working on a person? And can you give us a few of some examples that are near and dear to your heart of some dramatic responses? And then maybe an example of something very typical that, say, has been chronic. Sure.
I'll just give you some examples from this week, because they're really miraculous things that happen with NMT, but they're not the rare things where we reach back to a particular case and go, wow, this was so fantastic, I have to tell you about
everyday miracles.
It's everyday miracles, which is really amazing. So this week, I treated a patient who was a woman in her mid-20s in the 2nd month of her 2nd pregnancy with a condition called hyperemesis gravidarum, which is also termed nausea of pregnancy. And this was really severe. She was retching hourly, severe nausea all day long, couldn't keep anything down, even water, and she was really miserable. So this is a situation that happens not infrequently. It seems to involve some kind of an allergy response between the mother and the fetus. Because you have to realize that, of course, the fetus is only 50% the DNA of the mother. So you can imagine what would happen if you had a kidney transplant from somebody that was only 50% compatible with you. Well, similarly, there are a lot of changes that have to happen to a woman during the process of pregnancy to allow them to carry the baby. And sometimes errors occur, and that results in this nausea of pregnancy. We treated her once. She immediately had a 40-50% resolution of the nausea. We treated a second time a week later, and by the time that the treatment was finished, all of the nausea was gone, and I spoke with her this week, and she told me she'd had no return of nausea. So it was really quite amazing.
It is amazing. Let's look at something that a person has carried with them for quite a long time. You can get a sip of water while I'm asking this question.
Thank you.
If you like. How about something that is chronic that has maybe dogged someone for the better part of their lives. And so you're talking about really having to talk to this body. Can you give us an example of some of those? Because I think a lot of people watching right now probably have had something like this.
Sure. I had a patient who came into my office about 3 years ago with severe low back pain. She was a woman of 62. As I examined her, we often go through a physical examination as well as our NMT evaluation. What we found was that her range of motion was severely limited. If she tried to extend to arch her back in a standing position, she'd immediately have severe pain in the back, but she'd also have radiating electrical pains that would go down her legs. She could bend to within about 12, 16 inches of the floor. And she said, it had been this way for about 15 years. She wasn't even able to play with her grandchildren, and it was quite a limiting situation. She'd been to a lot of medical doctors, and she'd been evaluated pretty thoroughly, and there was no surgical situation. There was no clear pathology, no herniated disc. So we applied the neuromodulation technique, the sensory motor pathway, and by the time we finished about a 20-minute session, literally all of her pain was gone.
Amazing.
We explained to her that the changes that happened with her weren't physical changes. These were changes that happened at an informational level in her nervous system. We also explained that because she had a 15-year history of severe low back pain, that it was likely that she would see some of there would be a tendency to revert to this familiar pattern of pain. So it was interesting. Her next appointment was to be a week later, and she had called and canceled. So I thought, she'd been hurting for 15 years. I should give her a call and make sure she understands what's going on. So we had a conversation. She decided to come back. So we did 2 more sessions. And from that point on, she was completely pain-free. I think it was about a year and a half later, she came in again, had some small incident occur and a little bit of pain. We treated her once and released her. So it was really quite a wonderful response, and I understand she's playing very actively with her grandkids.
Very happily with her grandkids. That's impressive. How do you do with garden variety, sporting injuries, frozen shoulders, things like that?
Shoulder injuries respond very well. The shoulder is a joint that requires a precise integration of all this array of muscles that attach all around the shoulder in order to work properly. And when there's patterning within the neuromuscular system that upsets that, the range of motion is off, it's limited, there's pain, stiffness, and we usually see those things resolve very quickly.
Oh, that's great. Now let's get to another one, the buzzword. Everywhere I go, I've been meeting so many people, both in this line of work and outside, among friends and people at large. Cavitations. The subject of cavitation is our buzzword this month. Can you talk about what cavitations are, why they're a problem, and then I want to take a look at some of what you've done with cavitations, which is truly remarkable.
Cavitations are a situation in which the bone in the alveolar arches...
Can you say that in English?
The alveolar arches, yes. This is the jawbone. Alveolar arches refers to the bone in the maxilla and mandible of the jaw
that anchor your teeth.
That anchor the teeth. And there's a curious thing that happens where circumscribed areas of bone just die. And this is caused by thrombogenesis. It's caused by a thickening of viscosity of the blood that doesn't allow circulation and oxygenation and nutrition to get to the bone. So areas of the bone die. And when they die, all that's left is this trabecular architecture, this bony architecture. And the rest of the bone fills with microorganisms, pus. It's kind of a nasty thing. It turns out that it's not just a dental problem, but it's a systemic problem. There's a chemist, Boyd Haley, from University of Kentucky, who's done a lot of research in this area of biotoxins, and he finds that the anaerobic bacteria that live in these cavitations produce toxins that are 1,000 times more toxic than the botulinum toxin, which is considered one of the most toxic
Now, this
substances
is
in the
frightening.
world.
Yeah, this